Welcome, Councilmember McDermott.
Good morning. Thank you for the opportunity to join you today. I am excited about being here and having the opportunity to reflect on the local global health and life sciences industries and the impact they have in our communities here. Working to improve the health of our communities has consistently been part of my work. In my current role as a King County Council member, I chair the King County Board of Health, and I also serve as chair of the Council's Budget and Fiscal Management Committee. In both of those roles, we regularly make decisions that affect the health of King County residents. But my commitment to public health and global health in all of its definitions, because it starts local and goes global, really originates long before I was in public office. I was in fact very close to both of my grandmothers. Both of my grandmothers smoked, and I watched Grandma Seal die of lung cancer, much too young. As a result, years later, as a state representative, I introduced the first comprehensive Clean Indoor Air Act, banning smoking in all indoor public places, without exceptions for bars, restaurants, or taverns. Also, in my tenure in the legislature, I voted for the creation of the Life Sciences Discovery Fund in 2005. And since its first grant in 2007, the fund has awarded over $161 million to support Life Sciences Washington and improve health care. Because of that work, people are living better lives today. And I'm dedicated to creating opportunities to improve health because health is a social indicator. And not only am I doing that, but we're all well aware that the NIH does that in their work and is why their work is so critical. Good health can increase our chances to achieve success, allowing each of us to reach our full potential. At the same time, we know that other factors, such as income, race, and education, have immense impacts on health outcomes. Put together, this means that entire communities can be put together. This means that the health of entire communities can be predicted by factors that are broader than a person's visit to a healthcare provider. This is especially true of communities who experience systemic exclusion, including women, racial minorities, and members of the lesbian, gay, bisexual, transgender, and queer community. Across the world, the LGBTQ community are denied care, receive inadequate care, or avoid care due to discrimination or fears of criminal penalties. This community also faces higher rates of depression, cancer, and substance abuse. This has enormous implications on the type of care we need to make available and also informs how we interact with the LGBT community to bring their strength and expertise to the conversation. But we also don't have to go across the world to see these inequities. Unfortunately, we can walk it right outside the door. Across King County, communities that face the greatest barriers to success also tend to be those who have the poorest health outcomes. It shouldn't be a reality that a mere 13 miles can separate, a mere handful of miles can separate people with a 13-year difference in their average life expectation. But it is true. So I ask everyone in this room with us today, as you do your important work, think about not only the global implications, but how we can bring the impact of your work locally as well. And King County is home to a unique effort to make this happen. Global to Local is a partnership between local government, healthcare, and community organizations that uses strategies that have been effective in improving health in developing countries to address challenges experienced by King County residents. Those efforts have been highly successful, and Global to Local was recently named as one of 3 inaugural recipients of the Communities of Opportunity Grant. This is just one of many examples of how our regional health expertise is impacting lives of King County residents, making us healthier today. And now I have the opportunity to introduce Governor Jay Inslee. Through his many years of service to Washington, Governor Inslee has consistently championed Washington's life sciences sector. While in Congress, he worked to increase funding for the National Institutes of Health. As governor, he is working now to grow Washington's position as a global leader in life sciences and global health through increased STEM education, both in the secondary and the collegiate level. Under his leadership, Washington created the first position of Life Sciences Advisor in order to work with the industry, and has championed the Life Sciences Discovery Fund and the Washington Global Health Fund. Governor Inslee is working to ensure that Washington is making the right investments in order for us to continue as an industry leader, and I applaud that. Please join me in welcoming Governor Jay Inslee.